age-tailored and available to them. With young adults, they have very different reasons for quitting. So you can't treat a young adult the same as an older adult because they're motivated and the reasons for smoking are quite different. Our research and that in the published literature suggests that young adults are more motivated by their aspirational identity, so who they want to be, who they see themselves becoming. They really want to be in control. They see themselves as in control, no longer controlled by their parents. They want to be controlled by themselves, making their own decisions about who they want to be. It's really important to them that they want to be good role models for either their own children, their future children, or for members in their family like their nieces and nephews or siblings. Unfortunately, they are less likely to get advice and support from healthcare providers compared to older adults. The cessation methods for young adults, they prefer self-directed, convenient, flexible, and inexpensive smoking cessation interventions because they don't have as much disposable income at this age group. So the methods for young adult smokers really should be inexpensive or free. They need to be convenient. It's really effortless to use. So they don't want to be inconvenient. They don't want to have to make repeated appointments. They don't want to have to come back to come and see healthcare practitioners for more and more appointments. It needs to be really flexible and innovative. It needs to be highly tailored to the unique needs of this age group. Does anyone have any questions so far? You can either address them now or towards the end of the presentation. Okay, so common cessation approaches are quit and win content, social support, self-help materials, pharmaceutical methods, health professional advice, online support, and cold turkey. So I'm going to go through these different approaches and share with you what the literature and what Lisa Pack Behind has been doing. Okay, so I was just wondering, what does everyone think is the preferred cessation method used by young adults? Okay, so correctly everyone's identifying that they prefer unassisted cold turkey method. Now, even though they express a very clear preference for quitting on their own cold turkey, when we remove the barriers to other cessation options, we see that they are willing to use options like NRT. What the feedback we get from our peer outreach teams are that young adults at displays often don't see reading a book as a formal cessation intervention. And so they don't even it doesn't register with them that reading a book is actually going to help them quit smoking. So when they respond to methods on these surveys, they're indicating they want to quit on their own, but often that doesn't necessarily correlate with their interest in reading. Okay, so today I'm going to go through different cessation options and share with you some of the research and experience that our program has found over the last close to 15 years with these different types of interventions. So quit and win contests. Research shows that quit and win contests have high efficacy and reach in the general population. And so the various research shows that those who engage in doing the contest are 90% of them make a quit attempt. In our studies of our contest, we find that that's even higher. That's close to 98% of those who register for our contest actually go forward and make the quit attempt. The research says sustaining abstinence during a contest period is anywhere between 10 and 70%. Sustaining abstinence of 6 months is anywhere up to 35%. There's various components that are associated with abstinence, so having the support of a buddy, email support, and interestingly, prize incentive is usually found not to be related, but it is a useful recruitment message, but it's not the number one reason why that it's associated with abstinence. population reach of these interventions typically is 1 to 2%. So Leave the Pack Behind, since its inception, has been running a contest for young adults, and it addresses their quitting preferences. So our contest is called the Would You Rather contest, and we have 4 different categories. So it's not just a quit and win contest. We have, of course, the Quit for Good category. We have Keep the Count, where they have to reduce the number of cigarettes they smoke by half at the end of the contest. Then we have Party Without the Smoke. And so that really is getting at that social smoking, or for those regular smokers who are tempted to smoke when they're drinking, partying, getting them to build their efficacy, and so they stop smoking while they're partying, even though they're not committing to quitting. And then, of course, we have a category for ex-smokers and non-smokers called Don't Start and Win. And so our research, we've done the study a few times now, and has found that it does work. And so what we found is, based on the quit rate, 19% of those who enter the Quit for Good go on to quitting smoking, 12% for Keep the Count, and 8.9% for Party Without the Smoke. Now, if you want to hear more results about the Would You Rather contest, the Program Training Consultation Center is going to be hosting a webinar in May regarding Quit and Win contest in Ontario. So they're going to be presenting the results of Would You Rather, as well as the Driven to Quit contest as well in Ontario. This year was the first year that we actually collected data as to whether they self-identified as a member of a priority population. And so what we found was that 17% of the registrants, our contest this year, were actually members of a priority population. So 3% self-identified as Aboriginal, 3% as Francophone, 4% as LGBTQ, and 7% were newcomer. Now, we didn't do any targeted recruitment to those particular audiences. You can see along the right side that those were examples of the posters that we used. And so they were just sort of universally more appealing to all young adults, it appears. The provincial reach of our contest this year was 1.3%. Now we're going to talk about self-help cessation programs. And so what we found, what the research is showing, is that they have been proven as an effective cessation intervention for young adults. But the content needs to be age-tailored and evidence-based. It needs to include suggestions on how to prepare to quit, the different cessation options that are available to them, and how to cope with relapse. And so Lisa Pack Behind, back in 2002 and to 2004, we ran a study, and the results have been published in the Journal of American College Health and can be accessed on our website as well. And what we did was we ran a real-world randomized controlled trial in the community, and we compared an age-tailored intervention with an adult intervention, which was Canadian Cancer Society's One Step at a Time, and a Quit Kit. And what we found was that the age-tailored resource, which was tailored in a variety of different ways to 18 to 29-year-olds, was far superior at helping them to quit compared to the adult, as well as the adult intervention, as well as the Quit Kit. So based on our research, as I mentioned, Smoke Quit, which is the orange resource, and the green resource there, those are the self-help resources that we developed for college and university students. And so it's for those who don't want to quit and those who want to quit. And so the ITT for Smoke Quit was 11.8%, which was higher than the non-tailored One Step at a Time, the adult intervention, which was less than 4%. You want to, the purple booklet there is for young adults who want to help a friend, family member, roommate, or for a loved one to quit smoking. And this resource is, we recommend that smokers give it to those in their social circle who want to help them to quit smoking. We also give it out to non-smokers who want to learn more about how to support their friends to quit. If something's different is the resource at the bottom there, and this is the one that we developed for young adults in the community. And so based on the success and the receptivity that we found with young adults on campus, we wrote something different for these young adults who have a lower reading level and have different stressors. So this book is resources are given out either on campus or in our campus clinics by nurses and physicians. We are currently rerunning the study to identify the continued appeal and effectiveness of these booklets with young adults in the general population. Okay, so young adults are interested in nicotine replacement therapy, and it should be available to members in this age group. NRT, as you all know, helps to control with withdrawal symptoms and cravings. It doubles their chances of quitting long term. That's even more so when it's given by a health professional. It's not addictive, which is a common myth and concern among young adults in this population. So addressing that with young adults is really, really important because often they're quite concerned that they're going to become addicted to NRT. It does help smokers to reduce their tobacco use, and it is a much safer alternative source of nicotine than cigarettes. The research is suggesting that upwards of 50% of young adults are interested in NRT. So even though they express a clear preference for quitting cold turkey, when we remove the barriers of cost and we increase the accessibility of the intervention, we do find that they're very interested. And so I'm going to tell you about what Leave the Pack Behind is doing in the province. And I see a question here about whether or not the books are available to healthcare professionals outside Ontario, and absolutely, we can definitely make those available. We can just speak offline about how we can go ahead and do that because our resources have been disseminated in other provinces, actually. It's been piloted up in the Yukon as well as out in the East Coast, our program. And also, actually, it was also in Bosnia, for those of you that's quite interesting. So there was some international appeal as well. But the problem has always been with without sustained funding, it doesn't tend to be able to continue. So Leave the Pack Behind for the last 2 years has been offering a free 8-week course of nicotine patch or gum to young adults in Ontario. And so we modeled our online ordering platform after the STOP program because of the success that they saw. But with STOP, they didn't find that they weren't able to recruit a high number of young adults. So given Leave the Pack Behind demonstrated success in creating age-tailored recruitment messages as well as interventions, we've adapted it and have had enormous success in the last 2 years. Last year we had close to 6,500 young adults order nicotine patch or gum online. And so what they get is they get an 8-week supply of the patch or the gum depending upon their preference and their smoking level. They have a 12-page mini instruction booklet, which is that little red book there that you can see. And again, it addresses some of their common myths and facts that they commonly have around NRT. And then they also receive an age-tailored self-help booklet, which is Smoke Quit or Hate Something's Different. So depending upon whether they identify as being enrolled in a post-secondary institution, they receive one of those 2 books. We offer follow-up support, so they receive proactive support emails that integrate facts about quitting with short supportive messages, as well as referral information for them to go to the Smokers Helpline for additional support or to sign up for text messaging. And so we partner with Smokers Helpline to further support and prevent relapse. We've found that young adults are highly interested in this and will be disseminating the results this fall regarding the success of this intervention. We found that the appeal is high, so about 20% of those who ordered the patch or gum were actually like smokers who smoked less than 10 cigarettes per day. But they did express a high, level of nicotine dependence as well. Our preliminary results show that the longer that they stay on treatment, the more effective it is and higher success. We also give out the NRT to our campus clinics in Ontario. So nurses and physicians are giving out a quick kit as well as some NRT. And what the last 2 years have seen is that young adults are very happy to receive it and welcome and are receptive to receiving the NRT from nurses and physicians. But in our campus clinics, what we find is that they'll give out maybe 2 to 3 weeks at a time of treatment and then try to arrange a follow-up visit. But with young adults, as I mentioned, if it's not easy for them, they won't return. And so having to make another appointment presents another barrier. On the right there is a poster that we had in our campus clinics, encouraging them to either ask for the NRT from their nurse or physician that they were seeing in their campus clinic, or to go online and order it themselves. On the far left is a referral card that's a business card size that we do make available for all family health teams, community health centers, so that they can give the referral card to the young adults so that they can go online and sign up for the free NRT. No, we have not done any research with text messaging at this point in time. No, we didn't combine the patches and the gum for combination therapy. We stayed on monograph because it's all given out online, so we needed to stay according to the treatment monograph. Family health teams and CHCs and anyone else in Ontario can obtain the referral cards through public health units or by contacting Leave the Pack Behind directly. My contact information is at the end of this presentation. And so we'd be really happy to offer you the referral card as well as any tailored materials if you want to make the booklets available to young adults. We'd be happy to be able to provide you them. Now at the same time, I need to say that the NRT is only available while quantities last. And so right now, we went through the NRT much faster than what we were funded to provide the treatment for. So we currently don't have any product. So that is the downside, is we have run out of product currently, but I am expecting to be able to offer it again soon. So this is just an example of a comment. We frequently get emails to our head office, as well as posts on our Facebook, indicating how grateful they are for making this available to them. So this one here, you can see the ability to use this product without the cost is a huge relief and motivator for my quitting. Being able to quit without this cost takes a huge financial stress off me. I'm not actually sure who in this organization gets this email, but I just wanted to say thank you. So it's just a warm and fuzzy, just to be able to see and hear how much it means to young adults. You can see here we have a message there from someone who said, I had my last cigarette at 2 a.m. The patches are helping a lot, so I don't feel really angry. I'm halfway through week 2 of patches and it feels good. For us, we offered the 8 weeks of NRT because we wanted to stay on treatment monograph. And what our research has started is suggesting, and again, you'll hear about the results of the dissemination of NRT, is that the longer they stay on treatment, which is greater than 5 weeks for us, we found with young adults, the more success they have experienced. Yes, addiction agencies can access this in Ontario. Again, because we are funded by the Ontario government, all of our programs and services are for Ontario residents. But if you're out of province, we can discuss how to make some of the other resources that we do have available for you, how they can be adapted. So as we mentioned earlier, young adults are actually the least likely of all age groups to be asked about, to be offered, or to use assistive methods of quitting. And it's not because young adults have less interest, because in fact, this age group, they make even more quit attempts than adults. Our own research of nurses and physicians on post-secondary campuses has found that about 43.2% of young adults report that they were asked about their tobacco use by a physician. And other research indicates that young adults very much would welcome this advice and support and are receptive to receiving it. And so that really shouldn't be a continued barrier to being able to offer it. Unfortunately, I can't say when we'll be able to offer the NRT again. That really is dependent upon funding. So we are expecting to hear shortly from our Ministry of Health and Long-Term Care contacts have indicated that we should hear shortly as to when we'll be able to make it available again. But in the meantime, we're happy to take your contact information so that we can share the referral card so that once we do have the product available, you can again make that available. So they access all 3 strengths of the NRT. So again, it's per treatment monograph. So anyone who smokes less than 10 cigarettes a day, Pack Behind, in our 15 years, has done peer-to-peer counseling, face-to-face counseling, we've done email support, group counseling, and unfortunately we found that these are not effective or appealing for young adults. And we've observed the same result when it's offered in community settings. They will sign up for it, but they don't end up attending it. And it's just due to the many pressures that they experience between juggling school, workplace, family obligations. And so this type of one-on-one counseling and groups is actually not shown to be very appealing to this age group. They want to quit on their own, they want to quit with their friends, but not in a formal group setting. They don't want to have to show up somewhere, they don't want to have to commit, they just want to do it on their own. Now in terms of reaching young adults in the workplace, again, I think it would be, we haven't done personally, We the Pack Behind has not done the work one-on-one with young adults in the workplace, but there has, actually OSHA ran a webinar yesterday about reaching smokers in the workplace. And so I think it's just important, anytime you're interacting with young adults, that you're offering the age-tailored resources as opposed to just an adult resource, and not just giving them, one size doesn't fit all with smokers. So it's important to acknowledge that. We also promote the Break It Off app as well through Health Canada. So engaging young adults in discussion about their tobacco use and cessation. So these are just some examples of some quotes that we had about from our Facebook page and from our contest last year. So one of the contestants last year indicated that they've been smoking since they were 11 years old, and I'm 21 now. 10 years and probably 100 grand later, I'm done with it and with the free nicotine patches. There's another contestant who said, my motivation behind losing the stinky habit is to gain control again. Control over my decisions, control over my health, and control over that invisible monster who makes me all want one more cigarette. And so we see this over and over again with young adults. And again, we're currently working on a manuscript around young adults' reasons for quitting. And that control factor really comes up again and again. They really don't want to be controlled by anyone, not their parents, not an addiction. And so talking to them about that and how they self-identify with their future aspirations and their role models, those are really the reasons for why they're quitting. And so it's important to tap into those. So in consideration for clinical interventions when you're interacting with young adults, it's important to ask all young adults if they ever use any form of tobacco. And so it's important because lots of young adults don't identify as a smoker. So if you say, do you smoke? They don't see their few cigarettes as being a smoker. And so many of them don't want that label of smoker. And so it's important not to use that or when you're asking them about their tobacco use because it won't resonate with them. It's important that you ask every single time a young adult is seen. And it's important to ask in all different types of visits. So not just during their preventative health visits at their yearly annual checkup, it's also important if they come in to access birth control or for testing for STDs. Important also during dermatological visits because young adults really are motivated by their appearance and sex appeal. That was another reason why young adults quit smoking. And are motivated to quit is because they want to be youthful and they want to look young. And so those are the different types of visits that our research has suggested that nurses and physicians are less likely to ask during those types of visits. So it is important to capitalize on the reason why they're there to ask them about their tobacco use and to offer them intervention. And so it's important to offer them the age-tailored strategies where possible. And just as an aside to that, so even though when you're offering the age-tailored resource, so Smoke Quit or the Hey Something's Different booklet, young adults also indicate that they will hold on to that book until they're ready to quit smoking. And so our research says that they're not going to throw it out just because they're not quite ready. They will hold on to it or they'll share it with another smoker they know that might be willing to quit smoking when they're done. Yeah, so it's really important there. I see another comment there that in alcohol and drug screening, tobacco is not considered a drug by most young adults. And so that's a really important insight there. And often within other settings, tobacco isn't addressed in addiction settings or in mental health settings as well. Tobacco use dealing with, but it is important to keep tobacco use and cessation on the radar. In terms of e-cigarettes, the research is certainly showing that young adults, both non-smokers and smokers, are using e-cigarettes. Our research with the NRT provision over the last 2 years has indicated that those who are least successful in quitting are also more likely to report using an e-cigarette. Now, we don't know if the e-cigarette had nicotine or not in it, but what we do see is that those who succeed in quitting with the NRT use the NRT for stayed on it longer. They used it for the full, 6 to 8 weeks, and they also did not use an e-cigarette. That's an interesting question that I think should be discussed as a larger group than about reframing tobacco in all messaging as a drug. Not quite certain right now, but it definitely, there needs to be policies around tobacco use, and it needs to be included on all intake within different agencies and not just within medical screening, EMRs, within clinics. I attended a presentation at the Ottawa conference last year where one of the conference speakers was a social worker who indicated that tobacco use wasn't even on their intake form. And so that's concerning, especially when you're dealing with young adults, because this is, as I mentioned before, if we can help them quit before the age of 30, we can make the most impact on them. Okay, so it's really important to meet young adults where they're at. And so to talk about their reasons for smoking and for quitting, we really need to explore the co-use of alcohol, marijuana, and hookah, because all of those are factors for relapse, as well as preventing cessation and successful cessation attempts. It's important to understand their language and their motivations and to realize that they are very different. We need to be familiar with young adults' quitting preferences and offer the cessation approaches that appeal to them. It would be really wonderful if Ontario universities were able to go smoke-free, and certainly there are some campuses, both colleges and universities, that are looking at going smoke-free. Sheridan College in Niagara in Ontario and Sioux College are some of the pioneers that are trying to go smoke-free, but there's a lot of, it's a process anytime with policy, and so I think it needs to have a lot of support from the Provincial Association of Universities and Colleges, as well as from the provincial government, as opposed to this piecemeal approach on individual campuses, all trying to achieve that. So it's frustrating, for sure. If we help young adults quit before the age of 30, it nearly reverses all of the impact of their tobacco use. It reduces all of the consequences of tobacco use. Okay, so here's our final polling question. What type of message is most effective at promoting cessation among young adults? And I see there that Acadia in Nova Scotia has a smoke-free campus. That's exciting. It would be interesting. I'm not sure if my colleagues have spoken to them, but I know on campuses right now, enforcement is a huge issue, and whose responsibility is it to enforce the policy? Definitely, I'm sure there's lessons to be learned there from Nova Scotia, so thank you for sharing that. Okay, so going back to our polling question, see that the majority of participants indicate that positive gain frame messages and not negative are the most appealing messages for yes, messages that focus on the short-term gains and not the long-term health losses are most relevant to young adults. So if you talk to them about about how they might develop cardiopulmonary disease, that just doesn't resonate with them. Talking to them about seeing the consequences of smoking in their face. I know for myself, as a 20-year-old smoker, I had a physician tell me me that they could see I smoke just from looking at my face. And so it's important to look at those short-term gains, because that was a short-term gain in preventing that long-term consequences. And being really positive, which is what is unique about Leave the Pack Behind. We don't do all the fear appeal stuff with any of our recruitment messaging or our interventions. We really focus on the positive aspects and what they're going to get from quitting. So messages that work with young adults, targeting and segmenting strategies work with this age group, and acknowledging that different segments are dealing with different stressors. Staying current with their core values, so appearance, role modeling, reaching out through the different environments and lifestyles, so reaching young adults where they're playing, where they're working, and where they're living. Using peer influence, so encouraging them to enter age-tailored contests, reinforcing to them that there are fewer places to smoke. The tobacco industry's exploitation, so the flavors, the marketing, we don't tend to capitalize on and do a lot of tobacco industry denormalization in our program, mainly because we don't find it's as large of a motivator for young adults, because there's other more prevalent messaging that is resonates more deeply with them. Cost is a major issue with this age group, because they want better health, they want to go on vacations, they want to be able to have nicer things and have better products, lifestyle. So looking at that, drawing attention again to who do they want to be when they grow up. In conclusion, what have we learned in our 15 years of programming? Young adults require age-tailored messages. We need to ensure that the services are relevant. We need to frame them positively, and one size doesn't fit all. Can't treat adults and young adults the same way. So we do have resources that are available for order. We do have our self-help booklets. The Would You Rather contest can and should be promoted in any avenue in Ontario. We have free nicotine patches and gums, a business card referral to our site. New this spring and fall, we piloted this year, we're running a holiday quit campaign. So the goal is to stimulate smoking cessation attempts among young adults across the province. And so, and the rationale is that the literature shows that smokers choose special days to quit smoking. And they also search for information at the beginning of the week. And so our campaign is Make It Memorable, Quit Smoking This Victoria Day. So the Victoria Day falls on a Monday, so it capitalizes on that memorable holiday, as well as that it's the beginning of a week. Make it memorable, quit smoking this Canada Day. And so then to the left there, you can see we're going to have a printed palm card that is available for, to make available to young adults, and it's going to present all of the different cessation interventions that are available for this age group. And so we did pilot it last year, and what we found is that it resulted in a huge spike in young adults ordering nicotine replacement therapy. So here's my contact information. There's my phone and email. I'd be pleased to speak with anyone who wants to further discuss how to reach young adults. If you're out of province, I'd be happy to discuss with you how you can use and adapt our material for your audience in your province. Because as I mentioned, it has been done before, and we would welcome that. There's no sense in recreating the wheel if something else has been found to be effective. These are just some images that I thought I would share with you of young adults posting their selfies online. I'm not certain when the NRT is going to be available again. That's all funding related issues. My contacts at the ministry have indicated that we should be hearing shortly. So again, you can definitely contact me, and we can contact you and let you know when it does become available and send you the referral card. As of right now, I'm not familiar of any work that's being done in Manitoba. I haven't heard of anything going on in that province as of right now.
Okay, so everyone, we do have a couple more minutes left of the presentation. I know Heather had addressed most of your questions throughout the presentation, but if there are any additional questions at this time, please feel free to type them into the chat box, or if you're joining us via teleconference, you can push *1 on your telephone to unmute your line. Sharon, I see here that you asked, can you go back to the slide? Oh, I lost your question. Can you go back to the slide to the helpful cessation options, please? And so I believe Heather is going back to that slide for you guys. Just to note, you can download a copy of the PDF slides right here. So if you just click on the title of the slide, then go down here and click download, and you can save the copy.
Again, I really hope any family health teams and community health centers and any addiction agencies will contact us or your public health unit for the age tailored material. We're happy to make everything available and reducing tobacco use.
Okay, there's a question here, Heather. Any research about the use of cigarette images on promotional materials?
What the research is showing is that they relate to the image and it triggers their attention to pay more attention to the material.
Okay, and another question, is there any information regarding mental health and smoking and young adults?
Well, young adults who have mental health concerns, they are at higher risk for tobacco use, which is why it should be included within the treatment plan when helping them address their concerns and acknowledging healthy coping strategies and offering the resources available. It's not something that should be really shied away from. I know we've heard from health professionals that they don't want to address the tobacco use when they're dealing with a larger mental health concern. But certainly once a young adult is considered stable, the tobacco use really should be included as part of the treatment plan. Yes, young adults are interested in e-cigarettes for quitting tobacco.
And I see another question here, Heather. Does Leave the Pack Behind have a prevention focus?
Yes, we do include prevention through our content, as well as we run an annual campaign as well that talks about preventing, about not smoking, and about the different situations that where they're starting something that's hard to stop. So through a social marketing campaign, as well as through the Would You Rather content.
I'm just scrolling up to some of the questions presented earlier. There's a question here from Bonnie. What is the upper age limit for this group?
29
Okay.
is the upper age group that we're funded to service. I see someone else is asking a question about ranking the order of cessation of preferences of young adults. It's not really one size fits all. We did some earlier research in like the early 2000s around their preferences. And so it really depends upon the individual adult. And so what the research, it's been a while since any research has been done on that. So I think it does need to be repeated about their preferences. But we do see that they are willing to try various approaches like reading a book or accessing NRT. And again, the group cessation programs are they're not appealing or effective. It might be possible to include that within perhaps like an existing group program for mental health or for LGBTQ young adults. If there is a group counseling program, I would include it as part of an existing group. But to offer a cessation group, we've just found that it just isn't a good use of resources. The different social marketing campaigns that we have, we run our fall campaign is now going to be called Party Without the Smoke. We can share examples of that campaign as well. It'll be available. You can email me and I can send you those resources. Then we have the Would You Rather campaign that runs through December and January. And then we have Don't Cave to the Grave, which runs in March and April. And that's where it's focused on relapse prevention. So encouraging them not to smoke and to take up exercise or healthy eating. You can contact me directly or a public health unit in Ontario about ordering the booklets that you're interested in
Okay, everyone, so we're just about out of time now, so I'm just going to proceed quickly with the final few slides. Please do keep typing your questions into the chat box. Alternatively, you can email me. My email address is at the side here with your questions, and I'll be happy to pass those along to Heather to get her responses. So just remember, a link to the Learning Assessment 2 and evaluation will be sent out following today's webinar. It will likely be sent out tomorrow morning. Okay, and if you participated as a group, please be sure to email me with a full list of the participants by end of day today.
I'm not aware of any research with Popper's HC images. Certainly we've heard of it anecdotally at our displays and through our health professionals, but it's not something that I've seen any research on it. Quit Run Chill is still available, and we still do promote the intervention through the Holiday Quit campaign, which will be running this spring, summer.
Okay, so our Lunch and Learn webinar schedule for the upcoming year is still in progress, so we will be updating our websites shortly with that information. And thank you everyone for attending today's session. We hope that you enjoyed it. We do apologize for some of the technical issues at the beginning of the webinar. Hopefully they worked out towards the end. And thank you for joining us again. Thank you, Heather, very much for joining us today and presenting on your group, your project there. It was very interesting to hear about, and we hope everyone enjoyed it.